So chapter 8 is a super short chapter, and it talks about drugs that affect the autonomic ganglia. Okay, so acetylcholine is the neurotransmitter of the autonomic ganglia that normally stimulates nicotinic neural receptors. Individuals who use tobacco absorb nicotine, which produces ganglionic stimulation. That leads to all the increased heart rate, jitteriness that you might feel after you smoke a cigarette. Ganglionic stimulation increases both sympathetic and parasympathetic activity. And if they're both stimulated at the same time, the physiologic effects don't necessarily cancel out. However, again, sympathetic stimulation predominates in the cardiovascular system, so increased heart rate, increased force of contraction, while parasympathetic stimulation predominates in the GI tract. So after smoking, there's usually an increase in heart rate, blood pressure, and GI activity. There's also action in the brain that causes dependency and sort of reliance on tobacco. Otherwise, you might feel kind of not so good after you haven't had a cigarette for a while. So there's little use, clinical use for ganglionic stimulants, but they can be used to help individuals stop smoking. So what we're talking about here is nicotine replacement therapy. Nicotine has been shown to be harmful to fetuses, so we don't do this during pregnancy. But this is for your regular average person who's trying to quit. Usually works pretty well. However, people can start and stop and start and stop over and over again. So common adverse effects of these medications include taste disturbances, GI disturbances, and at toxic levels, respiratory paralysis and death. So we do need to be careful with these medications. So drugs on slide 6 used in the treatment of smoking cessation include nicotine gum, lozenges, patches, which are controlled release, inhalers, nasal sprays, as well as 2 oral medications. One is an antidepressant, bupropion, and it's used to reduce nicotine cravings, and the other one is varenicline, and the only thing it does is to help people stop smoking. So it blocks the effects of nicotine on the central nervous system. Usually what they'll do for patients is they'll put them on a patch for controlled release and then have them chew the gum. Helps them keep not only getting more nicotine, but helps them keep their mouth busy. Usually smoking is not only a chemical dependence, it's also a physical dependence too. You're used to going outside and going through the routine of lighting up and smoking a cigarette. Once people find that they stop, they're used to that habit, they miss it. So the gum kind of keeps them busy and hopefully helps with quitting. So on to slide 7. Ganglionic blockers bind to nicotinic neural receptors and reduce blood pressure. They're used for severe hypertension, and again, you don't see these used too often. Mecamylamine or Inversine is the only ganglionic blocker currently available. So adverse effects. Most of their adverse effects of mecamylamine would be caused by excessive blockage of the autonomic ganglia, visual disturbances, decreased GI activity, decreased cardiovascular and genitourinary function. So that covers this chapter. Again, super quick. Really just keep in mind that the autonomic ganglia stimulants are nicotine and different forms of nicotine used to help smoking cessation. So let me see if I can move on to another chapter here and get it over with since we still have a lot of time left in this video. Gonna do chapter 10, local anesthetics. So this video again is chapter 8 and chapter 10. Local anesthetics, again another quick chapter. Local anesthetics reduce responses to pain by inhibiting sensory nerves. So the most common clinical use is to prevent pain from happening in surgical, dental, or obstetric procedures. For example, somebody's getting stitches, we might put a local anesthetic to numb up that area. They're also in over-the-counter products for sunburn, insect bites, hemorrhoids, etc. So again, they inhibit that sensory nerve that carries the pain response to the CNS, and they act directly on nerve membranes. They do not inhibit motor nerve function, so they're not paralytics. They just prevent that pain from happening. So, local anesthetics are weak bases. that travel in the body as either uncharged or positively charged molecules. The uncharged version of it allows the anesthetic to cross the neuronal membrane and gain access to the sodium ion channel receptors that lie inside the membrane. When it gets there, it blocks that receptor and prevents the response from moving up the nerve, basically an anesthetic nerve block. Local anesthetics differ in their duration of action, their site of metabolism, as well as how strong they are, their potency. Okay. Two classes of local anesthetics, ester and amide. Ester anesthetics are short or moderate duration, meaning they don't last too long. They're metabolized by enzymes in the blood and the skin. Amide anesthetics are long duration and are metabolized by the liver. Potency is the ability of the anesthetic to produce a nerve block at a relatively low dose compared to other local anesthetics. So the lipid solubility, or how soluble it is in that membrane, directly contributes to its potency because that's how much drug is allowed to get across. If the site of administration has a lot of blood vessels or is highly vascularized, the blood supply will pull the anesthetic away from the site of action, reducing its effective duration of action. Moving on to slide 7. Topical anesthetic administration. It's poorly observed through intact skin. However, sometimes it is used. Common topical anesthesia includes TAC, which is a combination of tetracaine, adrenaline, and cocaine. It's being phased out because it contains cocaine, not a good thing. LET, which is lidocaine, epinephrine, and tetracaine. EMLA cream, which is lidocaine and prilocaine, and this is used a lot in kids before they get vaccinations. So parenteral anesthetic administration can be through an epidural, which is into spaces around the spinal cord, very common in pregnant women and surgery patients. Infiltration, which is very common in people getting stitches, which is an injection directly into the tissue. A regional nerve block, which is an injection around a nerve root, might get that in dental work. And cryoanesthesia, which is the application of cold to the skin, might be used in patients who have a fear of needles. Sometimes local anesthetics are absorbed into the bloodstream and have systemic effects involving the blood vessels, heart, or brain. So it can depress cardiac conduction and therefore cardiac function and cause cardiac arrhythmias. However, you'll see in the future some local anesthetics listed, like lidocaine and procainamide, at low doses can protect cardiac function and stop arrhythmias. You'll see that later on in our cardiac chapters. So the central nervous system, when we talk about the effects that anesthetics might have on that, including nervousness, tremors, convulsions, and CNS depression. And treatment of local anesthetic overdose when CNS excitation is present includes barbiturates and diazepam. Okay, so those are going to, again, sedate the patient a little bit, bring everything down. So if the concentration of anesthetic increases above where it's causing CNS stimulation, the central nervous system begins to become depressed as opposed to excited. Let's see. Allergic contact dermatitis can also occur from the topical anesthetics, and that would include your usual allergic response such as swelling, wheezing, nausea, vomiting, etc. And if an allergic response is seen in one class, like the esters, you can use the amides or vice versa. So we're not completely out of options. So local anesthetics are used for, again, different procedures. Cutaneous surgery, dental procedures, removal of hemorrhoids, insect bites, chickenpox, and obstetrical procedures. So on to the last slide, special considerations. Topical application with open wounds may lead to systemic absorption. Remember, open wounds have open exposed blood vessels. Systemic absorption can lead to hypertension, tremors, and convulsions. When administered parenterally, we want to watch out for cardiovascular and respiratory vital signs because too high of a dose can cause problems. Bupivacaine, not used in obstetrical or basically pregnant women, obstetrical anesthesia because it can cause cardiac arrest or death. So that covers chapters 8 and 10. And look for the other ones separately under other YouTube videos.